Every year, the World Economic Forum names its new young global leaders. They make up a group of remarkable people under 40 coming from different communities and industries worldwide. Now, 121 global leaders have been selected for 2021, celebrating the difference they are committed to making globally, particularly as this critical juncture. Well, according to WEF, these young leaders exemplify what we need most today: hope, empathy, authenticity, and the drive to develop solutions that can change the world for the better. Of the 121 chosen from across the globe, 2 are from South Africa: Justice and Correctional Services Minister Ronald Lamola and Professor Terrence Kommal for his work in healthcare. Earlier, I spoke to medical expert consulting executive chairman Terrence Kommal.
To me, it's twofold. One, it's recognition of the challenges that we have in the developing world and as a continent in Africa, and particularly South Africa, because a lot of my focus over the last 20 years has been in healthcare. But beyond that, I think it's a recognition of what we can do as a people in South Africa and Africa. Because I grew up from a very resource-constrained environment. I studied with scholarships, and I left home straight out of school for scholarships and just now settled in Pretoria. So I think it's recognition of infinite possibility, recognition of a solutions-based leadership in South Africa. And I think it's recognition that South Africa has immense potential to offer the continent as well as the world, because I think this is the first year after 3 years that South Africa again has young global leaders recognized by the World Economic Forum.
All right, we'll talk a little bit about the solutions that you have provided and some of the innovations, but perhaps just give us a sense of what it is that you're actually doing now. What is the work that you're involved in? I know that you've had a long career, particularly in terms of public service, first as a military doctor and then in the public healthcare system. Where has that all brought you to now?
As a servant leader, as I'd like to call it, I lead a group of healthcare businesses that work in the healthcare verticals that function as a platform business. So the bulk of my time works in the medical legal world, which supports work and people with claims, and some of the most vulnerable people in society would are accidents, train accidents, and other impactful circumstances that were not of their own doing. And these are very vulnerable people of part of the community that need assistance and rehabilitation. So we've created a centralized healthcare business that operates in 7 of the 9 provinces that provides access to highly specialized healthcare services, initially for assessments as well as rehabilitation for the long term for these very vulnerable communities. And I think it's a significant involvement. Just the road accident fund per annum spends in excess of 45 billion a year. And I've spent a fair amount of time. I did have a short period that I did serve on their board and other committees related to that work. And then we also have companies in the medical devices spaces, SAPRA-registered medical devices. We involved in healthcare facilities and services. And we also involved in nonprofit work for community work through an organization called Tolwana Accelerato, which focuses on nutrition, healthcare, and community-based healthcare preventative programs based in rural Limpopo, Mogalakwena, and communities that these basic skills and access to resources don't exist. And the timing couldn't have been perfect, Peter, because a lot of our projects were implemented and finalized at the end of 2019, just a few months before COVID came through.
All right, so let's talk a little bit about, because what WEF does, it recognizes young people who are tackling the world's most complex challenges with innovative approaches. So what were some of the things that you saw that were problematic, challenging, and needed some kind of solution that you decided, listen, we've got to do something?
2 major projects that have been taking my time for the last probably 10 years now. The first is in the medical legal space, is a fragmented system that you had. Because firstly, getting healthcare professionals to work together is a challenge because of how the system is built in South Africa. And then getting that system to work with each other and then integrating into a legal system and focusing on outcomes as opposed to individual perspectives and views. And I then saw the opportunity to centralize those services. So instead of a lawyer or a patient going to make 10 or 15 different appointments across different diaries and getting different views. And God forbid these opinions all conflict with each other, it doesn't take your matter any further than where it was. And over the years, we've built a robust system that involves a lot of cloud-based technology, some machine learning, AI, some robotic process automations, in which we now operate a central head office in Pretoria, but operate in 7 of the 9 provinces, in which we have clinical teams that what used to take up to 3 years for assessments to be done can complete these assessments in a day. So instead of a patient doing one appointment, coming back a couple of weeks, and views change, patient comes in the morning, he sees everyone he needs to, the diagnostics are done, the radiology is done, specialized blood tests and whatever is required is done. And so the inconvenience for the client is reduced, but also the efficiency of the system is increased so that the focus can be that the legal system can then take it forward, or the whoever the funder is can focus on compensation, rehabilitation, as opposed to the frustration of securing appointments. That was the early stage of what we've done as a business. And to a large extent, it's fairly automated at this point, building on people's skills and system skills collectively. And the second project that I'm working on now and implementing, and I think COVID's now obviously put a big span in the works in what we were doing, we were working with Anglo-American, specifically the Platinum Division, in building a decentralized treatment and non-communicable diseases program. So your diabetes, your HIV, and your other chronic, if it's communicable, but all chronic diseases that you needed care for in communities in which people were spending their grants and many days getting to the clinics to get their medication. And we've been working for many months now and over 2 years to build a system in which you could remotely document and monitor these patients, as well as get their treatments to them in the community, as opposed to them wasting their limited income that they have, especially the older folks in the communities and caregivers of young kids, so that they can focus on actually living and less on the impact that the healthcare has had, so that we can improve their exposure to healthcare, but also improve their access to solutions in their communities where they live.
All right, pretty innovative stuff. I mean, let's talk about the public health system quite a bit now, because you have a lot of experience, first, as I said, in the military, but also in the public healthcare sector. And this is something that's important for the majority of people on the continent. What do you see as the things that we need to look at and find solutions for in terms of public healthcare and making sure that everybody does have access?
Sure. I think, Peter, I've summarized it on, with what I call the 3 I's in any system that you work on, is when you lead in these organizations, you need to start first with integrity, knowing why you're there and who your actual clients are, then looking at innovation and looking at how you can find solutions within a resource-constrained environment and continent, and then look at the impact you potentially could have in what you're doing. And that's exactly what we need to do with the public healthcare system. It's not that we don't have funding. We have funding. But we have, and pre-COVID, we had a decentralized system in which central policies issued by national government, but each province, based on how the Constitution has federalized, in effect, our provinces, each province has its own system, and then each district has its own system. So there are systems like the District Health Information System, but there are the funding models and there's grant models. So there are multiple solutions that are being pursued in parallel. And I think the focus has moved away, or for a large extent, was not on service delivery, but on funding and focus on who's going to lead the project, who's the PI, who's funding this, who's going to benefit. And I think we need to move away from that. And that COVID has been a stark reminder of our focus of healthcare should be by the people, for the people. Because if you don't have a healthy society, and that's not just only treating healthcare needs, but preventing healthcare problems and focusing on sustaining a healthy community, we need to make sure that all the other factors, so your social determinants of health, contribute to that. So whether it be water, it be treatment, access to good food and sanitation, job opportunities, it's an entire integrated ecosystem. But the solutions lie in innovative solutions in which we're willing to take risk on new technologies and realize that there are some things that the private sector does well, and there are some things that the public sector does well. But in being able to share, we need to build a certain level of trust. And I think that's absolutely critical. No doubt there's also massive amounts of exploitation and over-servicing in the private sector, which also is unsustainable. So I think we have 2 unsustainable systems: a public system that's overburdened and bursting at its seams, a private system that has skills and resources that it has some levels of abuse, But if we were to put those together, we could focus on finding innovative solutions on what is sustainable, like we've done for COVID, and like we've found opportunities to collaborate like we're doing now with initiatives like Business for South Africa and other collaborative initiatives. These need to be sustained going forward. Healthcare is not going to be a COVID problem. We have chronic problems like HIV, TB, HIV and AIDS, TB, malaria, malnutrition, and other critical issues that have always been there, but we've never had this level of collaboration. And I think we need to support the system. But there also needs to be a direct contribution beside the tax base, like we're finding in COVID, from the private system that has innovative thinking solutions. Because by helping the public health system, you sustain your organizations and the economy, which impacts us all.
All right. And perhaps finally, once you said the continent holds priceless, untapped potential for creating sustainable value and unicorn enterprises by entrepreneurs. I think you are the embodiment of that in what you're doing. But how do we make sure that there are many more Terrence Kommals that the continent creates, particularly young people who've got energy and new ways of thinking?
That is why I've now, taken on an academic role at the Northwest University in the Faculty of Economics and Management Sciences, because that's exactly where I think some of the solutions lie. We need to change how we understand things from an education perspective. Obviously, the school system is a little bit more complicated to contribute directly, but at least a tertiary level, we need to change how we approach solutions. Just recently, I've had conversations with colleagues of mine saying, but Terrence, I'm a specialist in this, I'm a specialist in that in healthcare, but I still don't understand how this business system works. And that's where the problem lies. If you don't understand how money moves, how the economies work, and where solutions lie and what sustainable solutions are, then I think that's where the challenge is. And I think I'm the first volunteer. I'm talking to Brand South Africa and other organizations in which we all need to, given that we've had great opportunity and been assisted by society and community directly and indirectly to be where we are and where we're going, we need to give back to take our community with us in the spirit of Ubuntu, because we need to share our experiences. You can teach academics, you can teach theory, but you need to share mentorship, you need to share coaching, and you need to share sometimes with the youth who say, I've got this great idea, it's going to change the world. And they also need to say, it can change the world, but is your approach practical? And these practical learnings, we need to give back to societies and communities. And I'm the first to say that it's not, I think, an obligation. It's an implicit duty if we want to take our continent with us.
Professor Terrence Kommal, congratulations once again on being recognized as a World Economic Forum Young Global Leader. Thanks so much indeed for your time today and your insights.
It's such an honor and pleasure. Thank you so much.